Welcome to the Curtis Ambulance Blood-Borne Pathogens training. Upon successful completion of this training, the EMS provider will be able to define the mission of OSHA and its standards, examine the contents of your department's written exposure control plan, define blood-borne pathogens, provide examples of potential blood-borne pathogens, define the term standard precautions, and list personal protective equipment available for use. Describe the proper procedures to don and doff gloves. Explain the steps in proper hand washing. List examples of engineering controls. List examples of work practice controls. Recognize signs or labels that indicate the presence of blood-borne pathogen hazards. Discuss factors affecting disease transmission and distinguish modes of transmission of blood-borne pathogens. Discuss definition, incubation period, transmission route, signs and symptoms, and PPE to use for a variety of infectious diseases. Describe components of housekeeping and why they are performed. Describe necessary record keeping related to blood-borne pathogens and define an exposure incident. But why take a blood-borne pathogens training program? To increase your awareness of hazards, increase your knowledge base, understand steps to take for prevention of contracting or spreading illness, understand your role in the healthcare environment, and know how to make your environment as safe as possible for you and everyone else. Federal agencies, OSHA. OSHA is the Occupational Safety and Health Administration. They protect the health of workers by ensuring a safe and healthy workplace for everyone. They set and enforce the standards, require employers to develop written documents regarding implementation and training of the standard. They provide training, outreach, education, and assistance. Federal agency involvement. The CDC, or the Center for Disease Control, monitors national disease data, disseminates information to all healthcare providers. NIOSH works with OSHA to set standards and guidelines for workplace and worker controls to prevent infectious diseases in the workplace. Employer responsibilities, written exposure control plan. A plan must be in writing and accessible 24 hours a day, 7 days a week. Employees need to be knowledgeable on the location of the written plan. Do you know where our plan is kept? Our department plan is to be updated annually. The department plan will be written including all elements required by OSHA Bloodborne Pathogen Standard 29 CRF 1910.1030. The department plans needs to be tailored to our individual requirements. Content included in the plan: identification of hazards in the workplace, identification of which tasks could expose employees, identification of which employees could have potential exposure based on tasks expected, information on modes of transmission of bloodborne pathogens, identification and provisions of appropriate PPE, training of employee in use and care of PPE, maintenance of PPE and replacement of worn or damaged PPEs. Implementation of various methods of exposure control, standard precautions, engineering and work practice controls, housekeeping, access to receiving the hepatitis B vaccination, process of post-exposure evaluation follow-up, evaluation of circumstances surrounding an exposure, and maintenance of record keeping. Definition of pathogen: pathogenic microorganisms present in blood or certain body fluids that can cause disease in human. Risk of exposure increases in presence of open wounds, active bleeding, or increased secretions. Examples of bloodborne pathogen: HIV/AIDS, hepatitis B, hepatitis C, hepatitis D, syphilis, malaria. Other potential infectious material agents: cerebrospinal fluid, synovial fluid, pleural fluid, amniotic fluid, pericardial fluid, peritoneal fluid, semen, vaginal secretions, any body fluid contaminated with blood or saliva in dental procedures, body fluids in emergency situations that cannot be recognized, blood, saliva, vomit, or urine. Exposure potential. Contact with another person's blood or bodily fluid that may contain blood. Contact through mucous membranes, eyes, nose, or mouth. Non-intact skin. And contamination via sharps or needles. Safe practices. Everyone's got something that you don't want. Take precautions with every potential exposure, seen and unseen. Standard precautions. Term includes universal precautions and body substance isolation, or BSI. Includes a group of infection prevention practices applied to all patients in the delivery of healthcare, based on principle that everyone may have something you don't want, because you can't always tell what infection process someone may have. Application of standard precautions dictated by tasks being performed related to potential for exposure. Implies routine use of appropriate PPE and other practices in order to prevent exposure to any contact of blood or other body fluid. Protecting skin and mucous membranes. Perform frequent hand washing. Hand sanitizer acceptable in absence of soap and water, especially in absence of gross material. Wearing gloves does not modify hand washing skills. Taking precaution to avoid needle sticks. The type of PPE, or personal protective equipment, appropriate for your job varies with the task and the degree of exposure you anticipate. PPEs: eye and face protection, hand protection, protective clothing. An employee needs to be informed when and what PPE to use, how to don and doff PPE, limitations of PPE, maintenance, care, useful life, and disposal of PPE. PPE available: gloves, utility gloves, gowns, face shield, goggles, surgical mask, and head covering. PPEs can only be useful if they are worn. Know how to use your PPEs. If not sized and used appropriately, it's not like wearing anything at all. Note the loose fit of the mask over the bridge of the nose and the gap at the bottom of the chin makes this mask ineffective. Removing single layer gloves. Remember, the outside of the glove is contaminated. Grasp the outside of the glove with the opposite gloved hand. Slowly peel glove off, turning it inside out as it is removed. Place removed glove into the palm of the gloved hand. Slowly peel remaining glove off, turning it inside out as you remove it and capturing the first glove inside the glove being peeled off. Dispose of properly. Wash hands, including your wrist area. Removing double gloves. Remove outer, more contaminated layer of gloves before removing other PPE. Disinfect inner glove after removal of each piece of PPE. Prepare to remove inner glove last. Grasp outside of glove with opposite gloved hand and peel off. Hold removed glove in palm of gloved hand. Slide fingers of ungloved inside glove at wrist area. Remove second glove by slowly rolling it down the hand and fold it into the first glove. Discard the removed gloves. Wash your hands. Hand washing is the single most effective means of work practice control that is highly effective. Perform before and after every patient exposure. Perform after removal of gloves. Perform prior to eating. Perform after toileting. Wash your hands, including all surfaces of the hands and wrist. Wet, lather, scrub 10 to 15 seconds, rinse, and then dry. Frequently missed areas when hand washing is performed. Antiseptic hand cleaners may be used as an appropriate hand washing practice if your gloves remained intact, You have no occupational exposure to blood or other potentially infectious materials. Materials can be left to air dry on your skin. Choose a product with at least a 60% alcohol base. Engineering controls. Devices that isolate or remove bloodborne pathogen hazards from the workplace to minimize exposure. These include sharps disposal containers, needleless systems, self-sheathing needles. These devices are only good if and when they are used. Work practices. Practices that reduce the likelihood of exposure by altering how a task is performed. Hand washing. Recapping a needle with the one-handed technique if recapping is needed at all. No eating or drinking in the ambulance. Disinfecting equipment and vehicle. Changing from soiled clothing. Keeping work area clean and decontaminated. Handling sharps. Avoid recapping needles. If necessary, recap with the one-handed technique. Never break or shear needles. Use a mechanical device to move or pick up needles. For example, use forceps or pliers. Dispose of needles in labeled sharps container. Do not overfill the container. To transport sharps container, close the lid to prevent spilling. Hazardous material labels. Warning label of fluorescent orange or orange red with contrasting letter and symbols is used. Must be used to identify presence of blood or other potentially infectious material. The use of red bags substitutes use of labels. Factors affecting transmission. Mode of entry acceptable for that particular pathogen. Virulence, the strength or ability to infect or overcome the body's defenses. Number of organisms, the minimal dose necessary to cause infection. Resistance of the host, the ability to fight off the pathogen. Modes of transmission. Bloodborne, airborne, droplet, fecal oral, indirect, opportunistic, and sexual. Sexual route and opportunistic are not usually a concern of on-the-job EMS providers. Bloodborne exposure. Direct or indirect contact with blood or infected body fluids. Needle sticks, splash on broken skin, splash on mucous membrane, for example, your eyes, nose, or mouth. Airborne exposure. Particles remain suspended in the air a long time and float over a distance. Most risk at less than 6 feet from your source. Transmitted via sneezing, coughing, talking, and shedding of skin. The patient is to wear a surgical mask to minimize the spread of disease, TB, polio, pneumonia, influenza, chickenpox. Healthcare workers are to wear an N95 mask to prevent exposure to particles. Droplet exposure. Droplet of moisture expelled from the source's upper respiratory tract and then inhaled into respiratory system or contact with mucous membranes. The droplets are too heavy to remain airborne for long. They are transmitted via sneezing, coughing, and talking. Most at risk within 3 feet of source. The patient to wear a surgical mask, the provider to wear an N95 mask. Diseases include the common cold, influenza, meningitis, rubella, and whooping cough. Indirect exposure. Contact with a contaminated object or surface and then material is transferred to your mouth, eyes, nose, or open skin. Hepatitis B can survive about 7 days on a dried surface, and HIV does not live long outside the host site. Fecal oral exposure often results from poor or non-existent hand washing efforts. Contaminated hands transfer microorganisms to all surface and objects touched. Recipients touched contaminated surface and then brings contaminated hands to face or ingest contaminated food or liquid. Hepatitis A or food poisoning. The following slides discuss a few select diseases that may be problematic for the healthcare worker, or at least something to be aware of. Remember, assume all persons have something contagious that you don't want. Frequently washing your hands is the single most important step to keeping safe and healthy. HIV. HIV is a fragile virus that attacks the immune system. Eventually leads to AIDS, which is a collection of signs and symptoms. The incubation is variable and can be years. Transmission. It is transmitted by sexual contact, contact with contaminated blood, mother to newborn. Signs and symptoms can include fever, fatigue, sore throat, rash, diarrhea, weight loss, dementia, and psychosis. There is no vaccine available for HIV. PPE includes gloves, goggles, mask, gown, as needed to avoid blood contamination. Antibodies develop in approximately 6 to 12 weeks post-exposure. Post-exposure, provider needs to keep scheduled appointments for several lab draws. Hepatitis B. Hepatitis B is a viral infection. It can develop into a chronic state and it affects your liver. The incubation rate is approximately 4 to 25 weeks. It is transmitted by direct contact with blood or bodily fluids. Complaints start as flu-like symptoms: dark urine, light-colored stools, fatigue, fever, jaundice, abdominal pain, loss of appetite, nausea, vomiting. Symptoms can begin 1 to 9 months after exposure. The CDC states that hepatitis B virus can survive for at least 1 week in dried blood on environmental surfaces or contaminated instruments. It is not spread via contaminated food or water via breastfeeding, coughing, sneezing, kissing, or sharing eating utensils. PPE should be gloves, goggles, mask, and avoidance of needle sticks. Hepatitis B vaccine. It has been available since 1982. It is highly effective means of protection from the virus. Must be offered within 10 days of assignment to task involving exposed risk and must be free. If employee declines, a signed declination must be kept on file. An employee may at any time request the hepatitis B vaccine after initial declination. Hepatitis C. Hepatitis C is a viral infection causing inflammation of the liver. It is currently the most common chronic blood-borne infection in the U.S. It is the leading reason for the need of liver transplant in the U.S. Can lead to cirrhosis and cancer. The incubation period is 2 to 25 weeks. It is most commonly transmitted with contact with contaminated blood. Most common exposure is sharing needles and equipment for illicit drug use. Contagion throughout your course of infection. Symptoms onset slow, up to 20 years from current infection. Symptoms include loss of appetite, vague abdominal discomfort, nausea, vomiting, jaundice, less common than with hepatitis B. Currently, work is ongoing to develop a vaccine. PPE should include glove, mask, goggles, and avoidance of needle sticks. Tuberculosis. TB is a bacterial infection most commonly affecting the lungs. If a person has TB, it has the bacteria but is not ill. It can still spread the disease. Incubation period is 4 to 12 weeks, and it is transmitted via airborne droplets. A prolonged exposure can increase your risk. Signs and symptoms include fever, chills, weakness, fatigue, night sweats, weight loss, dyspnea, productive cough, and a chronic cough. PPEs, respiratory isolation, N95 mask for providers, tight-fitting surgical mask on patients. Obtain periodic skin testing. If positive, you need a chest x-ray. Provide adequate ventilation while caring for and transporting the patient with suspected or positive diagnosis. Chickenpox. Chickenpox is a viral infection. It is transmitted via direct and indirect contact and airborne droplets. Its incubation period is 10 to 21 days. Signs and symptoms may include sudden onset of a low-grade fever, mild feeling of not feeling well, and a rash. Contagious about 2 days prior to rash until all the vesicles have scabbed over. The virus dries quickly outside the body. Skin eruption continues over 3 to 4 days. PPEs include gloves, surgical mask on patient, mask on healthcare provider. Vaccination added to childhood immunization schedule. Shingles. Shingles is caused by the same virus as chickenpox. After chickenpox, the virus lies dormant in your body, and it may reactivate as shingles. Transmission. Direct contact with fluids in the blisters. Low risk if rash is kept covered. Contagious until rash is scabbed over, or about 7 to 10 days. Risk to anyone not immune to chickenpox. If exposed, you could develop chickenpox, not shingles. Most often appears as a unilateral stripe of blisters, most often on the trunk, that lasts 2 to 6 weeks. Can appear around one eye or one side of the face neck. The treatment, aimed at the symptoms, can be prescribed an antiviral medication to lessen the degree of the symptoms. Vaccination available for those over 50, not necessarily to prevent the disease, but lessen the degree of symptoms. It is not life-threatening, but can be very painful. Bacterial meningitis. Bacterial infection causing inflammation of the covering of the brain and spinal cord. It is transmitted via contact with respiratory droplets. Its incubation period is 2 to 10 days. It has a sudden onset of high fever, headache, stiff neck, nausea with vomiting and irritability. Infants, poor feeding and irritability. PPE, gloves and mask, patient and provider. Vaccination is now provided in a childhood immunization schedule. Antibiotic prophylaxis provided to all persons exposed and in contact with patients. Viral meningitis is most common, less dangerous, and the most to improve on their own without treatment. Influenza, the flu, is an upper respiratory viral disease, transmitted via respiratory droplet or airborne in crowded enclosed space. Incubation is usually 1 to 5 days. Adults are contagious 3 to 5 days after symptoms onset, up to 7 days in children. Rapid onset, high fever, headache, muscle aches, sore throat, and dry cough. PPE, mask the patient and the provider. Frequent hand washing. Daily cleaning of your environment. Phones, door handles, steering wheel, countertops, computers, stretcher. Best protection is the annual flu vaccine. Importance of vaccination. Vaccines allow the development of passive immunity to diseases. Vaccines can weaken or kill germs. You develop antibodies that stay in your body to protect you if exposed to that disease. Immunity may last a lifetime or may weaken, requiring periodic revaccination. Active immunity develops when you have the disease. Vaccinations protect from illness and serious complications from vaccine-preventable diseases. Vaccination has led to the decline in the number of serious cases of disease. Vaccines undergo extensive testing for safety and efficacy. General advice to avoid the flu. Get vaccinated. Cover your mouth and nose when coughing or sneezing. Use the elbow, not your hand. Throw tissue away after use. Wash your hands often. Avoid touching eyes, nose, and mouth with hands. Practice good personal health. Get plenty of rest, eat healthily, manage stress, and stay physically active. Pertussis, or whooping cough. Pertussis is a highly contagious bacterial disease. Its incubation period is 7 to 10 days, with a total range of 4 to 21 days. It is transmitted most commonly respiratory, droplet, and airborne. The most at risk are infants prior to vaccination and an aging population with lost immunity, or those never vaccinated. Signs and symptoms come in phases. The first phase, sneezing, watery eyes, loss of appetite, listlessness, and noticeable night cough. The second phase, 10 to 14 days of cough, thick mucus coughed up. Third phase, in 4 weeks, coughing decreases in frequency and can last for a month. Vaccination is the DTaP vaccination. Vaccine immunity, not lifelong, needs to be repeated for periodic revaccinations. PPE, gloves, surgical mask for the patient and provider, goggles, and possible gown. Complications often from the spasmodic, forceful cough, pneumothorax, rib fractures, hypoxia during coughing spells. Staph infections. Staphylococcus aureus, often referred to as simply staph, are bacteria commonly carried on the skin or nose of healthy people. Approximately 25 to 30% of the population is colonized in the nose with staph bacteria. It is one of the most common causes of skin infections in the United States. Most of these skin infections are minor and can be treated without antibiotics. Staph bacteria can also cause serious infections. MRSA, MRSA, methicillin-resistant Staphylococcus aureus. It's a type of bacteria that is resistant to the common antibiotics such as methicillin, oxacillin, penicillin, and amoxicillin. Consequently, MRSA infections can be far more difficult to treat quickly than traditional staph infections. Occurs most frequently among persons in hospitals and healthcare facilities who have weakened immune systems. MRSA infections, usually acquired by persons who have been recently hospitalized or had a medical procedure, are known as CA-MRSA, community-associated MRSA infections. CA-MRSA infections can be transmitted in settings such as workout facilities or locker rooms. They are usually manifested as skin infections such as pimples or boils. Results of contracting MRSA: skin infection, pimples or boils, pneumonia, bloodstream infections, potential death through sepsis. Transmission of MRSA. Transmission of MRSA. Spread of MRSA skin infection is direct and indirect. Close skin-to-skin contact, cuts or abrasions, and poor hygiene. Methods of contraction: crowded living conditions, contaminated items or surfaces, and a weakened immune system. PPE for MRSA. Gloves. Transport the patient with a clean sheet. Do not use the sheet from the bed the patient was lying on if possible. Avoid placing laundry in contact with your uniform. Wear gown if contact is made with uniform. Wash your hands. Vancomycin-resistant enterococcus, or VRE, is a bacteria found normally in your intestines. It produces diseases when bacteria invade other areas, your urinary tract, wounds, and blood. Healthy individuals are rarely at risk for VRE. Healthy individuals can transmit VRE via indirect method. Those most at risk have a weakened immune system and other health issues. It is spread via feces, contaminated equipment, and healthcare workers' hands. PPE: gloves, gown if closing contact is anticipated, hand washing, the single most important process to control the spread of VRE. Disinfect your equipment after calls. All these prevents the indirect spread of VRE. C. diff, a spore-forming bacteria normally found in the human gut that is usually not a problem. Overgrowth causes problems: mild diarrhea to colitis to death. A common cause of antibiotic-associated diarrhea. Antibiotic use increases the risk 7 to 10-fold while patient is taking medication for up to 2 months after discontinuation. The incubation is generally 2 to 3 days. C. diff is shed in feces. Transmission is usually via healthcare worker's hand. Contaminated material, surfaces, device contaminated with feces and not properly cleaned. Patients at highest risk have an antibiotic exposure, long length of stay in healthcare setting, immunocompromised condition, and advanced age. The symptoms are watery diarrhea, fever, loss of appetite, nausea, abdominal pain, tenderness. Colonization, positive test but no symptoms. Infection, positive test and clinical symptoms. PPE, gloves during patient care, hand washing after removing gloves, soap and water over alcohol-based hand gels. Alcohol does not kill C. diff spores. Gowns recommended for patient care and prevents contamination to clothing. Special considerations. Adequate cleaning and disinfection of environmental surfaces after care of any patient with diarrhea. Use EPA registered disinfectant with sporoidal claim for environmental surface disinfectant after cleaning surface of gross material. 1 to 10 parts bleach is effective. Cavicide is effective. Super sandy cloths are not effective. Important hand washing, barrier precautions, meticulous environmental cleaning of fecally contaminated surfaces are important. Norovirus, a highly contagious virus that is the most common reason for acute gastroenteritis in the USA. Outbreaks occur usually from November to April. It is transmitted via the fecal to oral route. Exposure to an infected person, contaminated food or water, touching contaminated surface, and then introducing the virus to your mouth. Symptoms develop 12 to 48 hours after exposure. Symptoms due to inflammation in stomach and intestine include abdominal pain, nausea, vomiting, diarrhea. They can also include fever, headache, and body aches. Improvement within 1 to 3 days. The virus can stay active in the patient's stool for up to 2 weeks. Complications most likely linked to dehydration. The best intervention is prevention. Good hand washing. Disinfect using chlorine bleach. Ebola. Ebola is a rare and deadly viral disease first discovered in 1976. Unknown natural host site. Most likely animal-borne, bats most likely to be the reservoir. A 2 to 21 day incubation period, average of 8 to 10 days after contact with Ebola patient. Direct contact with non-intact skin or via mucous membrane, contact with contaminated objects, contact with infected animals. It is not spread via casual contact. 1 to 10 parts bleach solution and cavicide wipes to be used to clean equipment after patient exposure. Ebola signs and symptoms: fever, severe headache, muscle or joint pain, weakness and fatigue, diarrhea, vomiting, abdominal pain, hemorrhage, bleeding or bruising, loss of appetite. Caring for the Ebola patient. Inquire or screen the patient for travel. West Africa, Guinea, Liberia, Sierra Leone, Senegal, and Nigeria within the past 21 days or 3 weeks of symptom onset. Treatment. There are no specific treatments available for Ebola. You treat the symptoms and fluid replacement. Isolation for suspected Ebola. Standard precautions every patient contact. Hand washing is extremely important. Contact isolation. Face, mask shield, double gloves, impermeable gown, and shoe covers. Droplet precautions. N95 mask for the healthcare worker with the surgical mask for the patient. And try to maintain a distance of 6 feet. Coronavirus was first identified in the 1960s. It is spread the same way as the common cold, by coughing and sneezing. Almost everyone gets a coronavirus infection at least once in their life, most likely as a young child. Signs and symptoms: runny nose, cough, sore throat. The coronavirus can lead to pneumonia, which is the leading cause of death. Coronavirus prevention: wash your hand. Keep your hands and fingers away from your eye, nose, and mouth, and avoid contact with people who are infected. Treat the coronavirus the same way you would a common cold: rest, fluids, and symptom treatment. General housekeeping: pay attention to what you are doing. Disinfect equipment between every patient contact. Decontaminate infected equipment as soon as possible. Wear appropriate PPE when performing the above task. Know the limitations of products based on suspected disease process. To begin decontamination, clean the surface of gross material. Can use soap and water initially. Soap is an emulsifying agent. One liquid disperses into another to allow the product to be removed. Metrozyme detergent and blood protein. After surface cleaning, then apply disinfectant according to product directions. Disinfectant must remain in contact with the surface for prescribed time period to be effective. Keeping the worksite clean and sanitary is a necessary part of controlling worker exposure to bloodborne pathogens. Cleaning schedules and decontaminations depend on type of surfaces being cleaned, determine minimal versus frequent opportunity for hand contact to surface, and type of soil that is present. Review product labeling for any special directions or precautions. Wear appropriate PPE for the task being performed. Remove all blood and debris from surfaces to be cleaned. Products can't clean the surface if they can't be in contact with the surface. Allow disinfectant to air dry. Read label directions to determine length of time to leave surface wet based on need for disinfection. Example of some of the products we use for decontamination. Ethyl or isopropyl alcohol products. Short contact time due to rapid evaporation, used for small surfaces. Alcohol may discolor, harden, or crack rubber and certain plastics if extended exposure over time. They're not practical for large surfaces cleaning, and it is not effective against C. diff or Ebola. Tuberculocidal products. It does not interrupt or prevent transmission of tuberculosis. Claimed to be used to indicate germicidal potency of a product. Indicates intermediate level of disinfectant. Capable of inactivating broad spectrum pathogens including bloodborne pathogens, hepatitis B, hepatitis C, and HIV. Bleach products. They're effective for C. diff and Ebola. However, you will not have a diagnosis at the time of transport and can shed bacterium in stool if asymptomatic. Replace the cleaning solution frequently. Contamination of solution and cleaning tools occurs quickly and can cross-contaminate. Cleaning up involved blood or bodily fluids. Where appropriate PPE, cover the spill with an absorbent material such as paper towels to prevent splashing. Decontaminate the area of the spill using an appropriate disinfectant, such as a solution of 1 part bleach to 10 parts water. When pouring disinfectant over the area, always pour gently and work from the edge of the spill towards the center to prevent contamination from spreading out. Wait 10 minutes to ensure adequate decontamination and then carefully wipe up the spilled material. Be very alert for broken glass or sharps in and or around the spill. Disinfect all mops and cleaning tools after the job is done. Dispose of all contaminated materials appropriately. Wash your hands thoroughly with soap and water immediately after the cleanup is complete. Medical records must be kept for each employee with an occupation exposure for the duration of employment plus 30 years and must be confidential and must include name, social security number, Hep B vaccination status, including the dates, results of any examination, medical testing, and follow-up procedures, a copy of the healthcare professional's written opinion, and a copy of the information provided to the healthcare professional. Hepatitis B vaccinations. Maintain employee status. Training on bloodborne pathogens is to be delivered annually. Requires access to resources who can answer questions in person or minimally via phone for instant access. Records to include date of training, contents, signature of trainer and attendees. Exposure incident. Consider occupational exposure if there is an infiltration of mucosal membrane via open or non-intact skin. If in doubt, check it out. Report all accidental exposures involving blood or bodily fluids to the ED physician of your receiving facility or your immediate supervisor. Immediately wash the site with soap and water. Flush, irrigate mucous membranes as necessary. Our current policy. Notification of significant exposure is to be reported immediately to the receiving hospital. Complete the notification of significant exposure form. Leave in sealed envelope for the EMS coordinator or manager. The ED doctor on duty will advise appropriate medical follow-up or need for consultation with private physician. Follow-up fees are responsibility of the provider. If ED care is rendered to the provider, they must sign in as a patient in the ED. It guarantees proper documentation of the incident and care rendered.